Hello folks, it's Simon Grant from Running Physiotherapy again. We're going to follow on our video series on the adaptation potential of the body and the brain and how everything works together. You can't look at your health without covering every part of the body and the brain. That's what you put in your body, how you use your body and what you think about. Today the main topic is going to be sitting. Recently one of the biggest searches online was neck pain, and one of the main reasons for that is sedentary lifestyle. In other words, sitting. People now in our generation sit for a massive potential portion of their life. 2 generations ago people were much more active. Neck pain and back pain were due to activity, not to sitting. Office jobs, computer jobs, sitting is a maximum amount of people's life these days, a much bigger proportion. So we have to look at how that affects your body and your mind. Your body adapts to everything that you do. So what you do the most of is what your body gets fit for. If you sit for a large proportion of your life, your body gets fit for sitting. So let's have a quick look at what sitting actually does to your body. You have a spine, and your spine is designed to be used and moved. Your body is designed to be used and moved. And when you sit, everything slows down. As you sit in a chair, if you were to sit with perfect posture, the curves in your spine would look roughly like this. Line down through the middle of the curves of the spine, we go straight down through the skull, through the middle of the curves, and end up on the sitting bones, the bottom of your bum. If you're sitting properly, you should feel the pressure through these 2 bones in your buttocks. As people sit, they concentrate on what they're doing. They start to lose concentration and self-awareness on their body, and if your dominant posture habit is a slouch, as you sit there, your body will start to slouch. And this is what happens to your spine. That forces your head forwards, and bear in mind the head's the weight of a bowling ball. Your neck's now having to hold the weight of a bowling ball hanging forward. The muscles that come up from your skull, down into the shoulders, are now holding a bowling ball weight. To look up, you have to stick your neck backwards to keep your head in the middle, and that shortens everything in the neck here. All the joints get pushed together, the ligaments get shortened, the muscles get shortened. Over a short period of time, 5 or 10 minutes, that's not a great problem, because you're going to get up and move and everything will get back to the normal position again. If you were to sit there for a long period of time, the body starts to adapt to that. If you start to do this day in, day out, week in, week out, month in, month out, year in, year out, your body will slowly adapt to this shape, and your spine will change into this shape. And before too long, you'll actually find it quite difficult to straighten your spine back up again into normal position. So imagine holding a bowling ball with your arm bent, with your elbow bent. The muscles in the front of your arm will start to scream at you within about 2 or 3 minutes. Why don't the muscles in your neck do the same thing? Well, they're much, much stronger. They're used to holding this bowling ball weight on top of your shoulders, but they want to, and they're used to holding it in a good position where the pressure's going straight down and everything's in balance. As soon as you start to lean forward, the muscles in the back of your neck have to suddenly take this weight, and because they're so strong and these muscles stretch quite a way down your back, they can cope with it for a short period of time. But if you start to become habitual in this position, these muscles get tighter and tighter and tighter, and they attach to the back of your head. They start to go in spasm in the back of your neck. They can cause headaches, they can pull the joints together, you start to lose the space between your joints, and over time this turns into chronic neck and back pain. And seriously, this is one of the major causes of neck and back pain in the modern world. So the outcome of this is you need to move, you need to change your position. Don't sit for more than 15 or 20 minutes at any one time. Get up, move, walk, stretch, then sit back down again. Just keep changing, keep the variety going, and that's the key to reducing chronic back and neck pain.